Okay, that'll work. Welcome everyone to Friday. We have a few guests and two panelists with us today. Chelcee Pullam is our chief medical technician, and Mrs. Cathy Smith is our school social worker. So we'll hear from both of them today. Remember, it's a coffee chat. So if you don't have your coffee with you, you need to, there you go. Caitlin's ready. Chelcee
got a juice box. Does it count?
We have a juice chat. Okay. From the health department. And Miss goes and gave me an apple fritter from Dunkin' Donuts this morning, because eventually what we want to do is go back to our coffee chats where we're sitting on the patio and we're just there together to be in one another's company and enjoy the social connections that we've missed for so long. All right, so a couple of things we want to cover today is the COVID update from Ms. Pullam. And then I've asked Ms. Smith to come and visit with us about what are some mental, emotional, social health, what are some things we can be doing to get through this a little healthier. Yeah. All right, Ms. Pullam, do you want me to share my let you share the screen or
share screen? Yeah.
Yeah. As a co-host, here you go.
All right. Let's do this. All right. Can you all see it, Dr. Winsor and Ms. Oh,
yeah,
perfect. Yeah. All right. So this is just for the week of January 7th through the 21st for a health update regarding COVID. So for right now, specifically Paideia, the amount of scholars for our positivity rate is 17.39. And again, this is all since we've been back, and the amount of staff who have been positive has been 6%. Our biggest amount of scholars and staff who were positive kind of came along our first week when we got back, because everybody was out there with their families and having fun and everything. But I do want to let you know that Maricopa County overall is at a 37.3%. We are below that, which is great. And just to keep you all updated, we are following all mitigation strategies and prevention plans provided by CDC. This is a big one that we just talked about this week, as far as in the event there's two teachers out sick in the same grade level, please be prepared to possibly have your scholars picked up. We'll notify you if and when that happens or ever occurs. This is just a recap on last week's vaccination status for anybody 12 years and older, as far as Pfizer, Moderna, and Johnson & Johnson. Again, if you are 12 years and older, you can get that Pfizer shot, both shots, and the booster. We would recommend getting the booster 5 months after you have completed your second Pfizer shot. I will post this actually on Dojo, so everybody can have a copy of this and you can take your time with it. This is another big thing. Go ahead.
Pullam, I think I'm going to also give you access to our Facebook page. Because then I think if you're posting on Facebook, it also can benefit the general community as well as our families. Okay.
I'm completely with that. All right. So we do get masks and supplies from Maricopa County. We have had a low supply. So we are asking if parents can please donate maybe a box of masks or a bag of masks to your scholars classroom teacher, just to help us out a little bit so we can all get through this together.
What'd be fun, I think, is, parents especially our parents are so generous. It's frequent that a parent will walk up and say, hey, can you bring this bag of paper towels and markers and sanitary wipes and sanitizer to my student's classroom? And we're always happy to do that. It would be really cool if parents were donating some masks that were like not branded. What am I trying to think of? Like holiday, or if it had some spring or winter theme. And I think that would help the kids want to, keep it on because it's their class. It has their theme on it. And that might be kind of fun.
I agree.
Because this morning alone, I picked up 4 masks off the ground that hadn't even been worn yet. They walked over from the front gate, got a mask, walked 30 or 40 feet, and there it lies, right, Caitlin?
Yes, we go through probably at least 2 boxes of those disposable masks every morning, I think, right, Chelcee?
Oh, yes.
So I think, yeah, it'd be, we want to be able to supply those, but it is a little bit sad to see those masks on the floor, not used, or used actually, but
Used or unused, right?
Oh my goodness. Yeah, it's a hard one. We do actually, I would say we go through another 2 boxes by the end of the day, for sure. But I know we'll get it
Also,
together.
the other problem, Ms. Pullam, is explained about the constant traffic of kids back and right.
Yeah, it's a hard one because we do have masks up front at the front office, and I do have a great amount of masks right now in my office. But the hardest part is when I do get scholars who are sick and they're in my office and I'm taking care of them, and then another scholar walks in without a mask. I get just really nervous because I don't want to have them exposed if that scholar is possibly sick with COVID. So
yeah, so then if the parents were sending a box of masks to that specific classroom, then they would not be walking around the hallway to go get masks. I think that would be a greater, a more simplified system. Yeah.
Definitely. All right. And for this last one, I just want to encourage everybody.
Can you go back to the last slide real quick, Ms. Pullam?
Oh, yes.
Sorry about that.
This is going to be a
idea.
Funny question, but how do I go back without exiting out?
Well, let's just do this. Let's stay right there.
Okay.
So the question I posed to Ms. Pullam yesterday during the CDC, the webinar from the Maricopa County Department of Public Health. Anyway, our webinar was the question about what about lanyards? I see just a very few handful of kids with lanyards. What do you think would happen if parents provided their kids with lanyards? What do you think?
I definitely think they're going to keep them on, and I think if they see everybody else doing it, they'll do it too.
Yeah, parents, help us out with that. I think if your kids had a lanyard, it would be much easier for them to put it on, put it off, eat, do their work, whatever, be outside, then be inside with it on. That would help us a lot. All right, I interrupted again, but go ahead.
Oh, you are completely fine. So again, these are just all things we've already talked about as far as wearing your face mask, getting vaccinated, as well as getting a booster shot, social distancing, and remember, just stay high or keep your hygiene up to par. And yeah, we have a lot of runny noses, boogies, and everything. One thing I do want to address is that I've had few scholars come and tell me that they went to the doctor's office and the doctors have recommended that they can come back to school before getting their COVID result. I would really, really, really love if you ever get a test and you don't have the result yet, to please keep your scholars home until that result does come. Because we have had a few come who ended up testing positive and then it ends up being an exposure. And now we have to go through this whole reporting and trying to make sure everybody's okay. So if you could please keep your scholars home when they are sick or pending results, that would be great for all of us.
Yeah, and I think that's a good point because it's not something that Ms. Pullam has created a policy about contact tracing and notifying. It is actually an Arizona statute. It's the law that we have to do that. And then we have to send kids home that have not been vaccinated. I think you'll review that. We have to send them home. So keep them home. That helps us a bunch.
Yep, definitely. And regarding the vaccination status too, Dr. Winsor, there is one other special exception that I didn't get to cover last week, as far as if you're an exposure and you do not have your vaccine, of course, we would send you home. But there's a special exception that says if a scholar is wearing their mask properly in class, they don't have to go home. So if I contact the teacher from a positive case in the classroom and they let me know that your scholar has not been wearing their mask properly, and they have told them multiple times, they'll be sent down and they will be sent home. So that's all I have.
That is so significant. That's a great exception. So parents, help us. Actually, you know what, Ms. Pullam, I want to just congratulate us, actually. I think we're pretty dang good at it. I mean, most everywhere I go, the kids are wearing them. There's some younger grades where it's a challenge, but I think we do a pretty good job.
Definitely.
Now, parents, I know that you're helping us with those reminders, but if they're wearing a mask consistently, and they don't have to be sent home. Very good.
Yes.
All right, I know there's going to be some questions. What we're going to do is we're going to wait till the end. You can type your questions into the chat box and we'll get to those as well. But for now, I'd like to introduce you, if you don't know, Miss Cathy Smith, who is like the angel sent from whatever heaven everybody believes in or wherever she is sent by all the angels of the world to be at Paideia. She's provides me with great comfort and calm, and she checks in on me as well. So I want everybody to know about Miss Smith and the services she provides. And so give us a message, Kate.
That's so nice. Thank you. I love to be here. I have told people before, but I've always wanted to work in a school as a social worker. And I love school and I love kids. And so I'm really glad to be here too. And so you want me to just give like a encouraging message about our mental and spiritual and emotional health, right?
Yeah, maybe some a review of some things we're going to launch and implement over the next little while and stuff like that. Okay.
What do you mean by things we're going to launch? Like our groups and things like that?
Yeah.
Okay.
Sure.
So we have one thing that I have been doing is trying to start pull groups and talk with classes too. One thing is mindfulness and bringing mindfulness into the classroom. And helping teachers also be mindful and helping scholars like understand what mindfulness is. When we talk about our spiritual health and our emotional health, and people throw around like mindfulness and meditation, and sometimes you're just like, well, I've heard that a bunch now and I don't really know what it means. So I love mindfulness because it's just an awareness of how you're feeling right now. So it doesn't have to be, there are apps you can download, there are meditations you can listen to or YouTube videos you can pull up, but mindfulness at the basis is just being present with where I am and being aware of how I'm feeling. And why that's beneficial is because it can help you decide then how you want to respond to things. If you're in tune with how you're feeling and what's going on internally, then you can, in habit one, to bring that in. How can I respond? I can stop, and be aware and then be proactive in my response to things. I can be aware of what's in my circle of control. I can be aware of how I'm feeling and then move forward with that. So I'm hoping to start doing that with classes and with teachers more. I have some new materials that I just got that I'm excited to give to teachers to do in the classrooms as well. And I can share those tools that, anyone could buy on Amazon also, if parents are interested in that. In addition to that, Mr. Madrid, our Dean of Students, is starting a Zones of Regulation program, similarly to mindfulness, but just to highlight what kind of zone am I in? Am I in like a red zone where I'm angry, mad, frustrated, upset? Am I in a green zone where I'm like calm and peaceful? Or even am I in a blue zone where I'm feeling like lethargic or lazy? So it's, again, just awareness. Awareness is so key. It's a foundation for all these other mental, emotional, spiritual health tips. Starting with awareness is so important. Yeah. So those are a couple of the programs that we have that are going on.
I want to share an app that I use I shouldn't say every night, because sometimes I don't. Sometimes I don't use mindfulness at night. Do you see my screen where it has the Calm app on it? So the Calm app is just something you could download on your phone from the Apple Store or Google Store, and there's a daily calm that is a message. Calm as 10 minutes, but there's a way to explore a lot of different areas of mindfulness in your own life. There's even ways to explore children. There's a part on here for kids, for families, and it's just a great app. For me, I found it very helpful. Calm, the Calm app.
Yeah, I like Calm. I have it downloaded on my phone too, because you'll sometimes get a notification and it will remind you to breathe.
Yeah.
So I really like that because we need that sometimes. I also use an app called Headspace.
Oh yeah.
And it also has tools for children of different ages. So I like that too. And I've used that some at the PLA campus as well. But I've also used it with my own son, or tried to at least. They have, nighttime stories to listen to for their, to help them fall asleep, like Sesame Street themed was one that we listened to. So that's a good one as well.
Right.
Another thing that I want to just encourage, I think, is a big thing with, just in general, but with COVID specifically, is to encourage connectedness within the family. So just the idea of connecting with your family or your chosen family, the people you live with, or the people that you trust. That can happen in a lot of different ways. For the Surgeon General recently listed some recommendations for how to talk with your family about mental health. So I wanted to give some of those. But one of them is just how to have challenging conversations, or how to bring those things up, how to find a quiet moment to talk with your family about things that feel serious or heavy. Asking your kids, like, what do you know about this? If it's COVID that they're worried about, it could be any topic. What do you know about it? And see what they already understand, or what they are perceiving about things. And then sharing your feelings too, because sometimes we think as parents, we have to be the strong one. We have to put on a brave face and just tough it out. But it's actually helpful for kids to know that adults are human too. And that we don't always know. I think saying, I don't know, like, I don't know the answer to this question, that's actually really powerful when it comes to connectedness, because we're just seeing the humanity in each other, and kids need to see our humanity too. And then with kids, you can reassure them, like, I'm here for you. We're here together. We're in this together. So it's not always about having answers. It's just, what's more powerful is just the reassurance that we're in this together. And that can really promote the connectedness within your family. And, in addition to that, just helping them to develop strong and safe relationships. And that could be with you. That could be with other family members or friends that they trust and you trust. And again, this is for your relationships too, not just adult to child, but, even within, I feel like our staff were doing some of these things, but spending time on activities that are meaningful to the other person. And just be reassured too, that the relationship, like having a safe and trusted adult for children, is the number one resilience builder. So for all our scholars, I'm so encouraged, because it's not always me. It's not always a teacher. It's Miss Chelcee, it's Miss Italy at the front desk. Like, our scholars go to people that they feel safe with and they feel they can trust, and they're making connections with people here. And it's very powerful for me to see. I love to just walk by and see a scholar connecting with an adult in the hallway and reaching out, because it means they trust and they feel safe. So that's been powerful for me to see too. And I want to encourage everybody in the community, like, connectedness and relationships, just taking the time to invest in those and check in with people is really, helpful in this time.
Yeah. Thank you for that. I do see, and I do feel as I walk through the building, a lot of love and a lot of powerful, positive energy from, and I love how I see what you just mentioned. I think of Italy and Edith and Isela, and even our maintenance guy, Sean Kelly, right?
Yeah, Irene. And
Irene, right? Letty, all of the support staff, the playground coaches, and we
Mm-hmm.
all are a family that cares about everybody, and we don't silo kids into, hey, these are your kids or my kids. We really have created a good community.
Yeah.
Hey, I know that I know most of the people in our audience right now, so I'm not necessarily talking to you, but this is going to be published out on our YouTube channel. And I want to ask all of the parents out there, please be kind. Our front staff, we are under an immense amount of pressure, not only by the pandemic, we're under an immense amount of pressure because the government requirements are similar to when we're not in the pandemic. So we're having to operate under certain requirements of testing and all this kind of stuff. And so we're all under a lot of stress. Mrs. Smith and Mrs. Pullam and we're trying to create this atmosphere of patience and love. So parents, when you contact a teacher or you come in the front office, I ask that you use the habits. Be patient, be kind. Don't automatically believe a horrific story by your child, because they're under stress too. So let's come together to seek to understand what's happening and then find solutions. All right, I'm going to open it up. If you want to raise your hand, I see the list over here. And if you have a question for Chelcee or Caitlin, either type it in or push the raise hand button or something. I'm not sure how to work this one yet. We're happy to take any questions. Nice, a question. All right, do you see that? Anyone? Do you guys see that? No. You can?
The question?
Hi, Ms. Gonzalez. I saw your email this morning. It says, I was wondering why scholars don't rotate to different specials during week, like we used to, probably like Monday, PE, music on Tuesday, art on Wednesday, and whatever, and a rotating schedule like that. And the question is, why did we move to the same specials for the whole quarter? She says, I think that would help scholars as well as far in connecting, staying active and positive. Yeah, we went back and forth a lot on that question alone. The challenge we had before was if a child had music one day a week, that means every Monday the child would have music with Ms. Casas, and then wouldn't have music again until the entire next Monday. And sometimes that Monday was a holiday, so wouldn't get it that day and get it a whole nother week away. Sometimes there might be an absence, so this child would miss music. And so the challenge with the specials teachers was, we're trying to create community, procedures, and relationships. And the complaint by the specials teachers was, I don't even get to know these kids because I see the entire 800 kids in a week. So as we analyze what some other schools are doing, we analyze the social emotional benefit. So we decided to go to what the upper grades already were doing, and that is have music for an entire quarter. And then the next quarter would be PE or health and wellness. The next quarter would be art. And the last quarter would be the Nexus nature class. And so what we're already finding is the relationships between the specials teacher and those kids are much greater. And one of the greatest things I'm seeing is that when the kids enter into art, they're ready to go right off the bat, because they haven't had to relearn and reestablish that system inside of the specials class. So that's how we're going. We're collecting some data to see how it goes the rest of the year. And we'll see where it goes next year. Thank you, Ms. Gonzalez. Any other questions? Here we go. Let's see if I got another one. Or you can raise your hands and talk to us. Man, I looked down this list and there's some good people.
Looks like
I see
Brittany
a hand.
Allen
Yeah.
has a hand raised.
Somebody has a hand. Oh man. Hi, Miss. Allowed to talk. There you go. Are you there?
Yes. Hi, Dr. Windsor. Hey,
Yay.
So my question or concern, just kind of thought process is just around like the exposures that do happen at school. what are the contingencies for kids who have to stay home and making up their work and doing things? I know that back in October, my daughter had gotten sick, and it was really just changing weather, her being having allergies and asthma, and she was sent home. And sometimes those COVID tests take a couple days, so it's like she's missing work. You know, you got to try to catch up if you can get the work from the teachers. If not, like you just missed that grade. With recent exposures and being a high risk person, it's like terrifying to send back to school. I'd rather test first just to be safe because of one, her health, and then potentially exposing others. So as far as them keeping up with their classes, getting their homework done, like what kind of contingency is in place, or what maybe would be put in place?
Yeah, that's a great question that actually raised up a bunch this last 2 weeks. And so we do have 300 Chromebooks available for home checkout in the baseline campus. And you can take that Chromebook home and just keep it home. It doesn't have to come back and forth. I got a new grant, so they're over there available for you. Now, the other thing with Miss Garrison is what we did was to revise and reamp up that Google Classroom so that those materials are available. Now, the other thing I just did, because I didn't realize that the materials weren't going home from the Liberal Arts Academy, is to put in the policy and the procedure, hey, scan some documents and make sure that that packet is ready for some. It's not like the child, the scholar certainly won't benefit from being sitting right in that classroom. And there's some work that you can only do in the classroom. But if the child is on exact path or reading eggs, that keeps them caught up. And if we can send the packet home, at least then the child has some stuff going on. But Miss Allen, I appreciate that concern, because it wasn't in the front of my mind, but this last week, at least it has been. Did you see any differences, or is this from before?
Before, and then with a current situation, like I kept Siobhan home today just for health reasons. She's high risk. I have a son who's even more high risk than her, and a potential exposure. But like I have both of my kids have their own Chromebooks.
Oh, good.
So I'll have her get on exact path today. She's gonna get tested today again, just taking precaution because both have severe asthma. And it's of course I want her at school. She wants to be at school. I think that the pandemic has caused like a mental break on the children there, where it's like, I don't care about being sick. I want to be at school, but It's like, hey, it's not quite the situation anymore. Like you have to be mindful of yourself and of others. And then like, lady, hey, you could die if you get this stuff. Like, let me just put it like that in like layman's terms so that you understand. But still want to make sure that she's getting her education. Want to make sure that, she's where she needs to be. She's keeping up with class. She's not missing anything.
Yeah. I took another note just to reamp up on myself to remember to make sure that this is happening. So thanks for bringing that back to my attention.
Absolutely.
If you don't, can I piggyback off of
Yes,
something?
May, please.
Miss Allen, you said, you're worried and you would like to get them tested before, just to make sure that they actually don't have COVID and things like that. I have put together a consent form that I'll be sending out. The only thing I'm waiting for is for more tests to come through for the school. But I will be sending out a mass consent form to all parents to give consent so we can test them here if they are ever exposed or symptomatic. That way we can hopefully give some type of relief for you all.
Absolutely. Sounds great. Miss Allen signs everything. So I'm probably the easiest parent. Yep. You got my consent. Yep. You need me there. I'm there. Yep. You need this. I got it. So
we appreciate it.
Absolutely.
Okay. We have a question from Ms. Gonzalez. How do you determine, this is going to be for you, Ms. Chelcee? Do you see it?
Oh, yes. How do you determine who's in close contact as far as being exposed when scholars go to lunch and recess? Is this tracing based off of who the scholars said they played with, or how is it determined? So from Maricopa County and CDC, we can't trace based off of recess or anything from outside. We trace from in classroom time and who they sit within like 3 feet to 6 feet from. And then off of that, we are looking at if scholars are properly wearing their masks. So that means over the nose and the mouth. And then they have to be sitting there for more than of course, 15 minutes for them to become like a candidate for exposure. Then we look at vaccination status. If somebody's vaccinated, again, we don't have to send them home. There's another thing as far as if you've had COVID within the last 90 days, we don't have to send you home as well because you possibly have the antibodies in your system. And again, these are just from CDC as far as their rules or special exceptions. So we're going and following those on point. I would have to say we're doing pretty well, as much as we can do. Yes, yes. If a teacher is positive, is the entire class notified? Yes, ma'am. So we actually just sent out a mass notification the other day. So we're trying to stay on top of it, like we said. And I would have to say a lot of times there might be a slight lag because we do have to send reports to CDC in Maricopa County for every single maybe like symptomatic or positive case there is. So it can be time consuming, but we are doing the best we can.
Yeah.
Let's see. I don't see any more.
All right. Well, we are over the time. So, well, actually, we're right on time. So here's what we're going to do. Next Friday morning at 8:30, we're going to be right back here. And I would love for you to email me or Chelcee or Caitlin. I'm going to put our email addresses in the chat box, I think. Yeah, there you go. So Pullam at paideiamail.com. I might not have spelled that right, but you get the gist. And C Smith at Paideia mail.com. Old guy fingers. And B Winsor at paideiamail.com. And please reach out, man. I check my email first thing when I wake up in the morning, and I think first thing before I go to bed last night, and one of the moms on this list, I got an email from her last night, and I thought, I'm just gonna go to bed. And she's good, and I'll just I'll check in with her in the morning. But I mean, I know Miss Pullam, I know Miss Smith well. We're all very diligent in checking our email and responding fast. So connect us with us that way. And next week we'll have some more COVID updates, and maybe Miss Smith will be back. I hope so. We'll have some other information for you. Until then, be well, and we will see you again soon.